Assalamu alaikum, ladies and gentlemen. Welcome to CxO Global Forum segment on health tech called Health is Wealth. CxO Global Forum is the world's largest C-level forum, and it operates in Pakistan, having members from a wide array of different companies, from MNCs to telcos to blue chips, and even some budding tech companies and startups. We have with us today an enterprising individual who actually made his name in the energy sector and is making a foray into healthcare in a very big way. Let's welcome to the show our guest, Mr. Owais Mir. Assalamu alaikum, Mr. Owais. How are you?
Assalamu Bilal. All is well. Alhamdulillah. Thank you.
Good. So we can start by touching upon a few things. So energy in general is a heavily talked about topic. NEPRA, with that recent announcement cutting the tariff rate for net metering, is taking a lot of people aback, especially those who invested quite heavily in solar. And just like with solar solutions being somewhat of an apt introduction and a fitting introduction for the Pakistani market, the same can be said for the introduction of certain healthcare devices, which Owais has started to get the hold of. So I think first and foremost, the audience would like to know what actually got you into healthcare, and what exactly is like your professional background, and how has that helped you in cementing a foothold in bringing innovative healthcare solutions to Pakistan?
Okay, Bilal, thank you. One thing which is quite common in energy and healthcare is that we believe in, like what our parent company, Dynamic Engineering and Automation speaks, it's all about a technology. So jitni bhi aap what you've been talking about, high-tech footprint on, we talk about energy, we talk about with the healthcare. So jitni bhi high-tech innovations, and normally that is being happening either in the energy sphere of the scheme, ranging from digitalization, automation, artificial intelligence. And that's something which is being right now into the healthcare over the last decade or so, and primarily being after this COVID breakdown. So that's one of the motivation, you can say, what we have tried to achieve and what we've been doing in energy can be transformed in a way in the healthcare sector, which is both from primary to the end-to-end affair.
Very aptly said. So I do recall that a few months ago, specifically on the 1st of July, 2022, you were responsible, in conjunction with Health Services Academy in Islamabad, for holding the nation's first ever genetics conference. In fact, you represented a principal over there from China that represented a very cutting edge medical device. So I'd like to hear your thoughts on that. In fact, even at that conference, I was invited to talk about the potential for the D2C genetic testing market in Pakistan. So, given the vast amount of traction you've gotten in such a short time span since you actually came into healthcare, what have your initial observations been, and what was that device? I remember, I believe the gist of it was you had your eye scanned and you could get predictive analysis for diseases that you currently have and we're likely to have. But you can elaborate more on that.
Bilal, the thing is, first of all, Pakistan is all about challenges. What we foresee on this and what we come into the canvas of healthcare is just a last year or later part of the COVID, when we got into this with working with NDMA, and then the offshoot units, primarily being the healthcare hospitals, some leading hospital, and then the United Nations. So what we draw out of it, that there was a huge gap. When you say a huge gap in terms of both, I mean from primary to the tertiary care, although whole the country, which is all about challenges and over and above all about that, as like a developing country having a whole budget of 1.6% or something like less than 2% on the healthcare. So you can draw that anything to talk about the from a high-tech perspective is always going to be a challenge, whether it's the public sector, by all means for sure, or even the private sector, who do not have normally being adherence to all this high-tech one and one way or the another. They are already making so much in the conventional sector, so they don't bother to come into that. What are the gaps where we can try to cover it with the high tech? So what we try to do, so like the event you mentioned, and what subsequently trying to do so still, although we have hit by a major floods, and that's on the healthcare sphere, most of the initiative got struck down for a bit. So the challenge which is there in that is that obviously the gap is huge, opportunity is humongous. But since a couple of things which you mentioned about genomics, now we helped and we enable one of the strategics in Pakistan, first of its genomic lab into over here, which is one started with one of the machine in the not in the healthcare, but in the livestock or in the agri industry, which is Pakistan Agriculture Research Council, in which one of the outfit you're talking about, OEM, which is MGI from Hong Kong-based Chinese company, is we enabled that to place it over here. Now the challenge what we had it is even in that project, which is a kind of a G2G project, and we just supporting them and to have its operational dynamics and helping it with reagent, is that there is no clear-cut value chain exists in regards to how much of test you need to do it over there, what is the cost, what is the rational created, because vis-a-vis, like in the healthcare domain, there are some applications of the projects. I'll not name it what are those projects are, but it is there, but it is no end-to-end integration on it. What it means that there is no enabling environment to create an ecosystem of what the technology eventually drives upon optimizing your current resources, which, as I said, is already close to the nil into the primary healthcare, is something what we are trying to cover it. So genomics is one part. Second, you talk about this company like AirDoc with this artificial intelligence thing, which we are trying to place it over here, which is what we are trying to have it towards creating the new perspective about the primary healthcare, or you can see the screening, in which the predictive analysis on helping up the hospitals, ophthalmology, because it's a retina-based screening covering you 30 to 40 diseases in an integrated one test. We're giving you the facilitation in the business, either it's a corporate, large-scale corporates, insurance companies, or even for that matter, you talk about any other adjoining ecosystem vis-a-vis with the public healthcare is concerned. So having said in nutshell what the answer to your question is that keeping that technology into the existing healthcare of scheme of Pakistan is quite a bit challenge if you wanted to be hands-on. So that's the point.
Absolutely, and it's something that naturally requires support from a lot of different sectors and a lot of different trained professionals. In fact, one of the highlights of that conference was the presence and the speech actually delivered by the chairman of the Special Technology Zones Authority of the time, Mr. Amar Hashmi, who called upon for facility to be made to promote and foster growth within health tech, med tech, and biotech. Would you be able to elaborate on exactly what else he said and what his overall arching message was?
Yeah, good question, Bilal. As a matter of fact, that's something, again, at the end of the day, we all talk about creating new things and connecting the right dots, blah, blah, blah. But in the healthcare, what I see this and what our country reads right now, it's a kind of a value proposition, whether in terms of our current economic situation, which is below the belt, in terms of any value addition that leads to the import substitution, or in terms of the revenue collection, either in terms of existing scheme or either in terms of the dollar. So you refer about STZA. Okay, it's an initiative of the initial initiative of the government, which is Special Tax Zone Authority. So our vision, and in fact my vision from the beginning of that, that if we all these Chinese large conglomerates, we are trying to bring it over here, which under the CPEC, which primarily been covering the energy sector in the last 7-8 years of the CPEC life, which is 70-80% mainly into the power sector, as you refer it to be of like a solar for that matter an example. So what we try to do so is to bring that CPEC kind of a module in regards to indigenous based manufacturing. No country can progress if it's, as we speak right now, is who do not have a manufacturing base, either being an energy dependence, either what being happening even in the other part of the world, like Ukraine conflict, the European EU situation right now. So the basic, the thing which can put us on our feet is the manufacturing of devices, whether general devices, MCGF devices on the healthcare. Since we were being exploring and promoting the healthcare outfit of it, so what we try today is to have a strategic arrangement with the companies of high-tech companies, which we are trying to bring it, like something like NewStop, which is our national imaging technology project, which we were promoting for the last year or so. With something with the biotech, which is stem cell technology, like a gene technology, and with what you just mentioned about genomics with the companies like BGI and MGI, which we are promoting it to have it over there. So we plan to have it cluster, create a basket, and to bring it into a one umbrella, and that umbrella could be a special tech zone that house like that we are importing from MRIs to CT scans to the PET scan, with the kind of a scheme right now which exists, which doesn't even have 10% of what is our prerequisite, considering our 240 million plus population, is not only to bring that, for example, national imaging project in Pakistan, but to create a scenario or an enabling environment to have that 2-3 years, 5 years down the line, we would be start manufacturing X-ray, CT scans, or even the MRI machines over here, not only for our indigenous market, but vis-a-vis for the exported. So vision is like that, but to reaching out this vision, you need to have a stepping stone. So that stepping stone, as you can see, and I explained you, is quite a bit challenge in this country currently.
Anything that needs to be done on a large scale is going to be very challenging, I think, anywhere you go. You mentioned CPEC, very interesting. And what exactly is it that you have planned for the China-Pakistan economic corridor in the realm of healthcare?
In the healthcare side of it, Bilal, since the government in the last JCC or even before that, there was a talk of a healthcare corridor between the two countries under the CPEC domain. So we were part of it from the discussion point of view, because it is not something which was being structured out recently. In this, we were planning to have it in active discussion in July, August, where we try to bring at least one of this project of national imaging technology, in which the project is like basis of 2 steps. One is to provide the upliftment of the existing facility. Having said, the hospital who do not have an X-ray machine, where you have for instance, 2,000, 3,000 patients every day, or footfall to feed it up, or to fill it with not only with the X-ray machine, but even up to the level of a MRI or diagnostic, if the economics or a demography works. And so first step of that project, which we are eyeing under CPEC, is that. Second project, as I explained, is that we create a capacity building. When we put up the equipment over there, now there is and I'll be a little bit blunt telling you that there is in every sector of here, we call it so-called mafia. So even in the healthcare, it's also, I see that there's a lot of OEMs tuned based ecosystem exists. Like they place the equipment and then they place it with the heavy capacity building, heavy O&M of it for the rest of the hospital or rest of the life of that particular business unit is. So which eventually limits the way of the new OEM or something like even, although no point of only talk about Chinese or any other, but for that matter, it limits the opening for many other value-added proposition that can come into play is. So what is it that in that we will think that under the G2G mechanism, if the project comes in the CPEC and then to deployment with the counterparty of which is in our case is the Ministry of Health, we are in an advanced stage of signing up agreement MOU with the ministry. So if that happens, so that paves the way for the step one, placing the equipment with the identification of the district headquarters or where it's badly needed, and then make it train the people to have its capacity building locally to have the value addition. And the second stage would be step two, which is the manufacturing under the STZA, as I explained earlier.
Right. And it seems like quite an elaborate process. Now, also coming from a healthcare background, one thing that I need to ask you, and it's very nice when you talk about manufacturing capacities in the country and the potential of innovation that you see in different incubation centers out there, like NUST and, for example, GIK are just two examples of incubation centers that have created cutting-edge medical devices. NUST had TREC-WAND, which was used for Parkinson's detection. GIK came out with a neuro sensor, basically navigated wheelchair. But at the same time, right, there is, I wouldn't really call it an issue. There is an impediment for getting, I think, all the medical devices out there in the form of DRAP's medical devices rules. What have your thoughts been on that specific amendment? Have you yourself had any difficulty in getting devices in because of that lengthy registration process? Do you think it's well drafted, or do you think it needs to be amended even further?
That's where the point is, Bilal. We wanted to do it. We have wanted to take on to the another different route is. We don't want it to be the line hangers, that you will be licking it on, having all this. I don't want to talk about the authorities or a DRAP or other. But what we generally see that in the Pakistan's healthcare domain, it's a kind of, again, a monopolistic situation. Some distributors, some distributors, there are every hick of a corner is a distributor, like what we being primarily an import-based mindset, distribution-based economy, that the people just talk about patthar uthaye to aapko distributor nazar aate hain. And then there are some big distributor who has all the right to play on their own cards. But then obviously with the value addition, there are some limitations or some barriers to the entry in the market. So that's why taking a different route. We are trying to come up with the value addition. We are trying to come up into, what do you call it, the scheme of how we can be like of a magnetic position. We draw something on the board. We try to make it into the methodological steps in a way that we, not the shortest route, but sign of a value proposition route in which we will create something, both as an example I've given you for genomics lab, for we're working with HSA NIH, and working with this ADOC, which is artificial intelligence, which eventually has to go to the draft. But once it will be proof of concept already in market, then you have a limitation of not to be bothering upon or having stagnant on all these approvals or things like that.
That's quite actually reminiscent and reflective of what a lot of people have actually been able to see in regards to the devices rules. Some have even had to, register themselves as pharmacies, fill out certain forms. Some of them had to get pharmacists on board. But again, what you touched upon is quite valid, that best is to just go with that flow. It's being implemented in the country for obviously a good reason, so that there is some level of quality assurance in the medical devices that come here, because likewise, the Chinese medical devices historically have been very price competitive. And this ensures that any sort of medical device coming from any country has to meet a particular standard. That generally is the case, with PEPRA when you apply for a governmental level tender. But even with the registration, right, there has to be parameters in place, and we're getting there. Finally, my last question is, What's next in store for Dynamic Health?
Okay, Bilal, what we are trying to do is obviously what we are trying to do is to kind of an enabler in a very challenging environment. So obviously enabler is always being a challenger over here because we are trying to make a distinctive route in which we are not taking a place and starting our lab, which any Tom, Dick, and Harry start doing it all and to have their revenue collection started over there. What we are trying to do is to connecting the dots with the public sector as well as with the private sector, which is mobilizing effective. So with that said, this is a challenge. And then with the right now, with the economic condition of country right now, in which obviously the basic health facility itself is a challenge, what being after this flood of that created havoc in the life of our beloved people, comprises of more than 70% which were affected, is quite a challenge. And with the global challenges, even in the case of the North American market and specifically on the Chinese side, is something of has its due position. Since again, as we are not trying to take a normal route like an import, starting an import or value chain, for us, we are trying to make people, the counterparty, realize that what we are trying to do so. We are trying to create a blend with the existing regime, with the anticipated values to connect them in a way that it will be beneficial for any user / counterparty / attaching collaborating partner into the three manner. One is identifying and address the gap where the opportunities exist, whether it be into the primary healthcare or whether it would be a secondary healthcare or either it would be a diagnostic part onto the value addition of the imaging is concerned. Second would be is to create or support the phenomena of creating a sustainable environment in which regular economies or sustainable economies will come in. Not that we supply 10 MRIs and then we are sitting for the next 5 years to be how the business model comes in. So sustainability of the business model. And third would be that tech, which is high tech, which eventually paves or supports the way of our trembling economy, in which if pharma has a budget of 100 million on the marketing and we bring the ear doc and we tell them, here is the predictive analysis with the artificial intelligence, what you've been doing, you manufacture this rather than manufacturing Panadol, you manufacture ABC. ABC will predict you into this. So eventually what you are doing is 5, 10, 20% you are saving on your production cost rather than to producing the right thing which is being needed on this predictive analysis on AI health.
It's like precision medicine for the pharma company, actually.
As a matter of fact, yes. So that's something, these three benefits or merits we are trying to create, and that's what our vision is. So hopefully it's a challenge, as I said earlier, but if we will be able to succeed and if we will be able to create a right team and right ingredients in the offering, then we have a strong chance to make ourselves into position in a distinctive manner.
Well, you know what they say, if something's not difficult, it's not worth doing. And it seems that whatever hard work you put in and what experience you have is starting to pay off. So we're lucky to have such people like you in the country that are spearheading such initiatives. It was a great honor to have you on the show, Wes, and continue doing good work. Have a good weekend.
Thank you, buddy. All the best again. Appreciate it. Cheers, mate.